Well, good. Well, I'm going to go ahead and just introduce myself. So I am Massinople. I am a functional medicine physician. I am a traditional medicine doctor that found functional medicine later in life, probably about 8 or 9 years ago. I went through my training, and then now I do functional medicine online. And what functional medicine is really looking for the root cause of disease instead of just treating symptoms with a medication or something else. So it's not putting a Band-Aid on it, it's really looking for the underlying cause of disease and treating it from the ground level up. So that's how I am a little bit different. And so I've started a masterclass series with Numa because they were looking for someone to sort of fill that part of wellness that could really allow us to be more of a holistic health collective together. And so we do. And we're going to ask you all what topics you might like to hear about too. We have talked about hormones quite a bit. A lot of women want to hear about hormones, and there was a big less about hormones because a lot more doctors are learning how to describe them monthly. The glyphosate is not for almost a year. So, but we talked about peptides as well. But there are so many opportunities out there to talk about, whatever is really interesting. I try to see what is a pretty common theme. Sometimes it's autoimmune disease that people are wondering about. And tonight, I really want to talk about how gut health affects hormones, because gut health is one of the most important things and the root cause of a lot of problems that we are having. Whether it has to do with cardiovascular disease, or it has to do with our metabolic health, or it has to do with our hormones, or it has to do with just fatigue. Gut health is where it starts. And so it is not exactly paid much attention to in the traditional medical model. Unfortunately, that's driven by insurance, what insurance is going to do. And tonight, I really want to talk whether a woman or a man, because these hormones, we all have testosterone and estrogen. It's just that men have more testosterone and we have a little bit more estrogen. So the gut health does impact that very significantly in all of us, and we know we do go through a transition in life when our estrogen levels drop pretty significantly. And some people, it drops very rapidly because you've had to have your ovaries taken out, or you've had breast cancer and you've had to be on estrogen blockers or something like that. So there can be really rapid transitions, but estrogen is very important for our gut health. And it's not just coincidental that you start having gut issues in midlife. And there are multiple things that sort of come together to cause that issue over time. So it's not really just about the hormone, it's really about our gut as well. So that's why I really want to talk about this tonight. So I always have to show a disclaimer that I'm not giving you medical advice. This is really more for educational purposes only. So take this information with some risk. And so, again, I told you a little bit about my story, but I worked in the ER for over 15 years. I am in functional medicine board certified, so I have worked in clinics as well, in urgent cares and all of that. So I was in the traditional model for a very long time, and I stumbled upon functional medicine because I wanted to make a clinic, create a clinic that actually used nutrition as the base. And because I know all of the diseases we were treating over and over and over again all started with what we were consuming on a daily basis. And so I found there was actually this certification of functional medicine, and it's a thing. So I started my training and then worked through that and pretty much even during COVID in 2020. And right now I'm under this in telehealth. But COVID opened our eyes to some things that it should be a no-brainer that our metabolic health is tied to so much other health issues, and much of this has to do with our nutrient status, our vitamin levels. It has to do with what we're eating every day. It has to do with our inflammation levels. So a lot of this has to do with inflammation, and the gut is kind of where all of that starts. So really, that's why I opened my clinic. I now have something called the Renew framework that I work within, and Renew just stands for restore the gut, elevate the nutrient status, nourish the adrenals, eliminate toxins, and then weigh and balance the hormones. That's kind of the order in which I work with everyone, whether you're a patient or you're a membership with us. because a lot of times we can. So tonight, really what we're going to be talking about is a couple things, so you have a better understanding of really how important gut health is to our overall health status, and why your gut just governs a lot more than just your digestion. There's something that is called the estrogen. I'm not sure if anybody's heard of that. You've probably heard of the microbiome. The microbiome is in our gut. It's the trillions of bacteria that live there, but the estrogen is that group of bacteria whose only job is to metabolize estrogen. So it really has a lot to do with the hormones themselves. And you'll understand why perimenopause hits the gut so hard. And perimenopause, remember, starts 10 to 15 years before the actual diagnosis of menopause, and you don't have a period for 12 months. And that's really the diagnosis. So there is a gut cortisol estrogen triad. So I'm going to talk a little bit about how stress really influences our gut health as well as our estrogen levels as well. And we cannot ignore stress in any type of treatment that we're doing. And that's why Numa is so important, because it's tapping into nervous system retraining that no other thing can do. It's just a different element of being able to get to nervous system regulation by using different techniques, whether it's breath work, cold plunge, and all that as well. And then just to have you have an understanding of what symptoms you may be having and the patterns that go together, but why labs miss it. You know, labs are at one point in time. Yeah, it's not that I don't do labs. I do labs all the time. But I don't hang my hat on everything. And I don't say because these labs are normal, you're normal and everything's fine. It's all in your head. Go elsewhere. That's not what we do. It just means we have to look deeper. And sometimes it's something you just can't measure. So labs can look normal. And the traditional labs, the insurance will cover. It's not always the labs that we need. And sometimes they don't cover some of the labs that we need for whatever reason. It's just not, approved yet for that. So I want you to just have an understanding of where we start and why we start with that foundational piece, and then be able to build on it, and how it really dramatically changes a lot of things when you do one thing, and that's look at that. So again, the gut is more than digestion, so 70 to 80% of your immune system is in the gut. So that's a lot. When your gut health is off, you will be getting sick more. There is no question. You're going to be the one that gets every illness that your child brings up. And a lot of it has to do with gut health. Neurotransmitters, like serotonin, that's our happy neurotransmitter. It's largely produced in the gut. So again, there is a gut-brain connection that is very strong here. Systemic inflammation is either amplified or calm here. So if you have a lot of inflammation, again, I always start with healing the gut first. And a lot of people can feel the nerves pain, there's some joints that hurt, your gut's like uncomfortable. Sometimes you're swollen, you get a little bit of edema. Inflammation shows up in a lot of different places. It also shows up in labs, and I do specifically look at inflammatory markers in a lot of people. Hormone metabolism happens here also. It's not just in the liver. So there is an active process that happens within our gut that has to do with our hormones. And there are many contributing factors to that, because toxins are a big part of this. And one of the talks I had given before, I did discuss some of these endocrine disrupting toxins that are very problematic, and they impact how our gut can actually handle toxins as well, and can be part of that disruption that we get within the gut. And it's what we live in every day, but there are these things. So we end up talking about toxins later. But when the gut is off, really everything downstream is going to be off too. So we cannot ignore it and just put the Band-Aids on the symptoms, because we don't really, and there's a way to heal the gut. There is a process, but it's a lot of what we can do every day, and get some action items at the end of what you can do. So what is the gut microbiome? So it's those trillions of bacteria, fungi, there's other microorganisms that live in our digestive tract, and they are there for a reason. They help us. They actually are able to digest things that we cannot digest, and they make products that our body uses for other purposes. So we want to have a healthy gut. And, because again, it's not just responsible for digestion. It's responsible for your immune system being trained. It's responsible for the inflammation that we have in our body. And it's also responsible for that hormone metabolism that I was talking about. And really, diversity is going to be the goal in your microbiome. So I know some people get in a rut of eating the same thing every day because it's healthy and I like my turkey sandwich and like that's all I'm going to have and my eggs in the morning and I'm going to have my little protein and potatoes at night. Your brain is what wants the consistency. Your gut 100% needs diversity and variety. So the more color, the more different types of vegetables you can incorporate, the more fermented foods. And you'll hear me talk about ferments and probiotics. Like those are all things that our gut thrives on, and we want to keep it balanced because when it's balanced, everything's happy in your gut. And then if you really just think of it as an ecosystem, that they thrive or struggle based on what's given. So again, let's give it what it needs to be able to thrive. And if you have to go on an antibiotic, it's not the end of the world, but yes, it will knock out the good guys in your gut as well as the bad guys that you're trying to treat with the antibiotic. But there's a process of rebuilding afterwards. So we just know that we want to make sure we pay attention to that if you have to go on an antibiotic. And this ecosystem is really the foundation of almost everything that we'll be talking about tonight because the gut microbiome is where it's at. And I feel like, I can't remember, a few years ago, Time Magazine had the gut microbiome on the cover of Time Magazine. So the amount of research that is going on with the gut microbiome and what it is linked to is so vast. Like I couldn't even possibly tell you how many research studies have been done on it, and we're talking about it with this associated with fertility, associated with Alzheimer's disease, associated with cardiovascular disease. I mean, you can look up look up any of that, and you're going to see an association of poor gut health with just about every chronic disease that is out there. So it's that important. So what are the main gut disruptors? So that's on the left side. So the biggest gut disruptors that are out there, and I just wanted to list 5 of them. Numero uno is chronic stress. It has been said that chronic stress is responsible for 70 to 80% of all doctor's visits. It's that significant. I mean, you can get physical symptoms with chronic stress. And so again, that's why I love Numa and having a way to help regulate our nervous system. Because we all have it and we can't ignore it because it's going to show up as a problem later down the road. Processed food, sugar, and low fiber. It is the standard American diet, and it is such a shame that that's how we were taught, that's what we were raised on. It's different now. So we just know that stuff has got to go. It's shrinking food to me. I mean, a lot of the food that's out there is not even real food. So, you know, if you shop on the outskirts of the aisles in the grocery store instead of the center section because that's where all the fresh produce is. You know, really concentrate on that. It's not that you can't have anything in the middle, but the things that are in a box and bag can usually be a problem. Just pay attention to what you're consuming. And we know sugar is a big driver. I mean, there's no question. Things are getting sweeter and sweeter out there, and it drives a lot of chronic disease and metabolic health is where it's at, and it drives problems in the gut as well. Antibiotics and other medications. So other medications include counter anti-inflammatories. Like, so don't just be popping the ibuprofen that you leave because your big toe hurts a little bit. Like, make sure you're taking it for a good reason. It's not that you can't have it, but we know it's a gut disruptor. And same with the antibiotics. It's not that you can't have an antibiotic when you get true bacterial infection. But you know antibiotics are prescribed, so it's not for the drippy nose. If you're going to go to the urgent care with a runny nose and a sore throat, they will give you an antibiotic. So you don't need to take the antibiotic for a viral infection. You never do. And it's going to get better on its own. And just know that you're disrupting your gut every time you take an antibiotic. And it's a matter of time before it goes and causes another problem. So you can't take them when you really need them. Environmental toxins and chemical exposures. Again, this is a big topic in and of itself. Major gut disruptor. Glyphosate, which is in Roundup, huge gut disruptor. And so it's things like that we are going to try to control as much as we can that's in our control at home, and like getting rid of certain things in our home and how we consume foods and produce, because there is, I'll just give you the website at ewg.org, the Environmental Working Group, does great studies on all kinds of products. They always come out with the Dirty Dozen and the Clean 15 every year. The Dirty Dozen is those 12 fruits and vegetables that you should always buy organic, and the Clean 15 are the ones that you can eat if they're not organic. Now, I know that we live in Mobile. We don't have Whole Foods anymore, or Trader Joe's, or any other cool places like that. So we're a little limited, but I have discovered, Costco surprisingly has a pretty good organic section. I find out I can get different things at different places if you might have to go to 2 or 3 grocery stores, but you're able to do it. And then if you really understand how bad it is to consume these pesticides, you're going to want to try to do organic if you can. And then, the hormone shifts. So declining estrogen is a gut disruptor. As your estrogen declines, it disrupts your gut. Estrogen allows us to have a healthier gut. So it is one of the biggest causes of gut disruption in midlife. And it is why it's not a coincidence that you start having GI issues when you're in the perimenopause stage. And then the symptoms that result from all this gut disruption, it can be the bloating, the gas, and unpredictable digestion, like those digestive issues, but it can be food sensitivities. That is a sign of gut disruption as well. And it's food sensitivities that come out of nowhere. You could have been eating something for 20 years and have not had a problem with it, and all of a sudden you're sensitive to it. It's because of all of this that is built up, and it's that gut disruption. Fatigue, brain fog, mood instability. Again, this is all coming from the disrupted gut very often. Immune reactivity, like a food illness, or just inflammatory flares, like you get this rash periodically, it just flares up periodically. That's the gut to me. Really, the skin is a window to the gut. And that's what I tell people all the time. Anybody who comes to me with a skin issue, we're looking at the gut first. So that's very important. And then if you are on hormone replacement therapy and you're just not 100% getting better, you're still having all these GI issues and whatever else, sometimes you can't fully treat those menopausal or perimenopausal symptoms because your gut health's off. So we just can't ignore it. And then, like I said before, the gut is really upstream from almost everything else. And so it regulates the immune function, inflammation, hormones. So we don't want to just treat the symptoms without addressing the underlying gut issues. And that is where we start every single time. And it's that foundation that has to be built and then we can build upon afterwards. And then the estrogen, I'll kind of speak to that just a little bit because I'm sure no doctor has ever talked to you about the estrogen. And it's kind of a new thing that they're really finding how it's like this exquisite ecosystem. And it's really pretty complex what happens in our gut and how it handles different things, and hormones is so different. And so they really just metabolize estrogen. So some of these bacteria, that is their main job of what they do. And it's within the big gut microbiome too, but there's just a group that comes together that does that main job. And it determines how much estrogen is circulating in your body. So even though we've known about this for getting close to 15 years or so, they just don't talk about it very much. But there's a lot of research coming out on the estrogen because we do feel like it can be driving different things. It can be driving different, whether it's not necessarily cancers, but sometimes it can drive cancers. And it can drive other estrogen dominant type symptoms. It can drive PCOS, it can drive endometriosis and all that. So it is very important. And a lot of times it's the missing piece when hormone symptoms persist for a long time. So this just shows you what happens with estrogen. So like the liver processes your estrogen and it gets it ready to be eliminated. And then it goes into the digestive tract and it's ready to exit the body in the colon. And then the estrogen produces this enzyme. It's called beta-glucuronidase. And beta-glucuronidase tends to go up when we have imbalance in our gut. If you have significant, I call it dysbiosis, it's just the imbalance of the gut bacteria. A lot of times this number is really high. So what happens when that number is high, beta-glucuronidase leaves a little piece of estrogen off, makes it get reabsorbed into the circulation, and then your estrogen dominant. Instead of using it and losing it. Our goal is to use and lose our estrogen. And so if you can't do that, that's when estrogen dominant symptoms start to occur. And so what do those symptoms look like? Sometimes it's bloating, fluid retention, breast tenderness. Some people have those fibrocystic breasts, so they have fibrocystic changes in their breasts. Sometimes heavy or irregular periods, mood instability, irritability, weight gain around the hips and midsection, even when you're doing everything right. So again, it can still be all coming from there. And then when you have too little estrogen, so sometimes people just don't have very much diversity in the gut, you kind of knock down a lot of the gut microbiome and the estrogen, and so you have lower levels of beta-glucuronidase. So this can cause low mood, brain fog, cognitive slowing, vaginal dryness, joint discomfort, these are all signs of when we go through menopause, decreased libido, absent or irregular periods, and then, somebody who has ovaries that should still be functioning and they have really low estrogen symptoms, like this is where you need to look. So a lot of times it can be coming from the gut. And so you can take the same woman and you can look at the lab, same age, same levels, and they all have different estrogens, they can have completely different symptoms. So it does not, it's across the board, everybody's different in those gut bacteria that we have. And it has to do with what we've been exposed to over the years. And some of those gut disruptors that are in our life, and where can we get rid of them? So really the low estrogen symptoms in a woman whose ovaries are still functioning, and estrogen dominant symptoms in those hormones who have, like those people who have hormones that are kind of in the normal ranges. Again, this gives us a sign that something can be going on in the gut. And that's kind of causing that confusing picture. And really, so just the gut needs to be addressed before the hormones can fully do what they're meant to do. And so, why is estrogen so important for the gut? So these are the things that the estrogen actually does for our gut lining. So it maintains the integrity of the gut lining. I'm talking about the little cells that your colon cells that hold together with a little junction, that it helps keep those tight junctions tight. And so as we lose our estrogen, that tends to loosen up, and then you get things that leak into the bloodstream. And that can cause intestinal permeability. So the other thing estrogen does is it supports gut motility, so it keeps things moving. So we want a good, active gut to be able to get these things out. And, and this can have to do with people who have constipation and things like that. But it also has to do with motility even higher up, like of the stomach as well. And the estrogen also promotes diversity of beneficial bacteria, and it shapes the microbiome. And so when estrogen is stable, the gut tends to be pretty resilient. So it's great for a long period of time, but then again, once we start getting this decline, then things start to show up. And so the protective effect on the gut lining weakens, but I will have to say I have never seen a single patient who probably doesn't have a gut permeability problem, because we all have assaults to our gut over the years. So it's not just estrogen alone, it's lots of other assaults that cause this leaky gut phenomenon, which can lead to a lot of other symptoms and cause inflammation. And really, as the estrogen declines, we know the microbial diversity in the gut microbiome changes. So we get different bacteria. So those good guys start to go down, so the bad guys start to rear their ugly heads. So that's where we start getting this imbalance. And then intestinal permeability increases. I talked about that. The junctions kind of break apart. They start leaking out into the bloodstream and cause your body to be like, what the heck is that? And become inflamed. So inflammation rises, and then the gut really can metabolize estrogen as well, and then this can increase your risk of cardiometabolic disease. So we're talking about insulin resistance having to do with the gut, 100%. So we cannot ignore it. It's that important. So it really does impact our cardiometabolic health as well. And so there is this bidirectional breakdown. So the declining estrogen disrupts the gut, and disrupted gut starts mismanaging your estrogen, so it becomes this vicious cycle that is happening. So each of them make each other worse. And so it just accelerates in perimenopause, and it's why so many symptoms start to come out during that time of life. And sometimes it can feel sudden, even though it's been building for years. You finally have kind of tipped yourself over the edge, and then you start getting a lot of symptoms. And so if you feel like you have bloating that just appeared out of nowhere, food sensitivities that you never had before, constipation or unpredictable digestion, that you have hot flashes as well, it's not a coincidence. It's probably the same thing that's going on, and it's the same system breaking down. And a lot of it has to do with the gut. And so we like to treat the gut and hormones together, in order to get that entire picture taken care of, so we're not just chasing symptoms. And obviously, after a surgical menopause, you can get a lot of the body symptoms all at once. It's a tough adjustment for the body to make. You have to have surgery sometimes, whether it's getting your ovaries out, or breast cancer, you're having to go on a medication that's really going to make your estrogen decline rapidly. You're going to have a lot of symptoms with your gut as well. So just switching gears a little bit, this is just an image of all the things that stress impacts in our body. So it's pretty much everything. But we're going to be kind of concentrating a little bit more on the gut and digestion. But chronic stress is a bad problem that is ignored a lot of times in our current medical model. And it's not just about being on an antidepressant and anxiety. That's not what we're talking about. It's learning the techniques and the tools that you can do at home to tell your body it is safe, to train your nervous system. We can retrain our nervous system. It's the coolest thing ever. Like, you used to think, like, you can't do anything. Like, once you have brain damage, you're done. No, you can make it better. We can create that. We can totally train the nervous system again. So it is malleable, and we can impact it by the things that we do every day. And so what does chronic stress do to the gut? So it definitely reduces microbial diversity. So people who have high stress levels have less bacteria, the good guys, in their gut. It increases intestinal permeability. We get leaky gut. And you know, like, when you felt stressed before, like, you get GI issues, right? Like, that's that connection. Between our gut and our brain it's a very sensitive connection that we have. And then you get more systemic inflammation when we're more stressed out. It goes hand in hand. And it disrupts the estrogen, worsens the estrogen mismanagement, and then really we know the gut cannot heal in a body that's locked in survival mode. It's the bottom line. So the body will always prioritize survival over hormonal balance. So you're going to lose the other. Your body wants you to survive, so everything else is going to kind of go haywire. So no amount of hormone support fully corrects the system that's being suppressed by chronic stress. You just can't fully heal unless we address the stress part too. And then there's this triad of the pattern that gets missed is when people do have gut dysfunction that drives the estrogen recirculation or depletion, and then the cortisol dysregulation suppresses your progesterone, damages the gut lining too, and then you get more estrogen imbalance, and that further disrupts the gut microbiome, and all of this feeds into each other. And they all show up in the same person, but yet we treat them all separately. And you go to different doctors to get all these different symptoms handled. But really, it's got the one underlying source of gut. And so, again, that's why the care looks fragmented. When I see people who have seen multiple specialists for bloating and digestive issues, obviously they've seen the GI guys that get treated for IBS, and they're getting maybe put on a PPI or Pepcid, some sort of script for their symptoms. Anxiety immune changes, you might be on an antidepressant or an anxiety med. Hormone symptoms, you either get a prescription or, unfortunately, some people still get dismissed too early on, because notice that start 15 years ahead of time, and there are things that you can do before it's time for true HRT to be given. And then each symptom gets just treated in isolation, so the goal in the middle is still not there. And so these are the action items you can start today. So it is, feel free to take a screenshot of it. All of us, especially women, are under eating protein. There is no question. They have just increased the daily recommended allowance for protein, and I even go up a little bit more for that because I know women are not getting enough protein. And the key thing is we've got to keep those protein levels up in order to prevent the muscle loss that we are getting every year, especially if this starts in the perimenopause time. So you should be thinking about muscle as a longevity organ. Don't try to lose weight. I want you to try to build muscle. Don't even think about losing weight, just think about building muscle. When you start building muscle and you do the right thing, the weight loss will be a side effect. It's the bottom line. Lower the body's level of inflammation, focus on protein, whole foods, again, it'll be a side effect. And so really prioritizing multiple colorful plant foods. There are phytonutrients that make those pretty colors in all of our fruits and vegetables. They all have health benefits, and they all do something different. So whether, you should always try to get some purples and some reds and some greens, like get all of the different colors. Try to have the most colorful plate that you can, because it is doing something for you. It's giving you a different nutrient that maybe you haven't had before. So try to, look at the produce aisle a little bit differently. Like really try to get, I haven't seen a purple sweet potato. Let me grab a purple sweet potato instead of a regular one. Yeah. And they're awesome, and they're giving you something different than a regular orange sweet potato. And I want them to. Oh.
etc.
Yeah, so they have a lot of different.
They do have the Japanese green one, sometimes they're stopped.
Oh, good. And Virginia's has them too. Yeah, so just whenever you see a different vegetable, a different color, a purple carrot, whatever it is, like we try to incorporate more color because it's doing something for your body. And
I have a question about that. Do you have to eat the purple, like the skin of the sweet potato, or is it the meat?
you don't have to. You can still get it on the inside. Yeah, so it's still a different profile of nutrients versus a regular sweet potato. And actually, just to speak to that a little bit, a lot of the orange foods are carotenoids. They have beta carotene, alpha carotene in them. So carotenoids, believe it or not, help with the beta glucuronidase issue. When you have high beta glucuronidase and you may be estrogen dominant, focus on carotenoids, those orange foods, whether it's pumpkin or sweet potatoes, squash, all of that is good for that. So consuming adequate protein is very important. So fiber and proteins. Now I will say that if you go to try to consume 30 to 35 grams of fiber, and on average people are consuming maybe 15, that if you start getting gas and bloating, like definitely back up on it a little bit, gradually build up, but if you're still having gas and bloating, that can be another problem. So there is something called SIBO, small intestinal bacterial overgrowth, that when I have patients do a 21-day reset diet, where it's an elimination diet, where we are eliminating all of these inflammatory foods just for 21 days, because it clears the noise and it allows you to kind of know what's giving you problems when you start to reintroduce them. But I find that if somebody doesn't get significantly better after an elimination diet and they're still having more gas and bloating, it's probably because they're not getting enough fiber, which is probably because they have SIBO. And it just means those bacteria are too high up in your digestive tract, so they are starting to ferment the food too quickly, so you get bloated. And so some people find that they get bloated worse and worse throughout the day, like it starts in the morning and then it just builds. And like some people mine was pregnant sometimes because they're so bloated by the end of the day, and that means the bacteria are on the spot and they need to treat it.
Have you researched about the way that let's work on that? Is L. reuteri bacteria that makes it in the liver?
Yeah, and L. reuteri is great. L. reuteri is great.
I've been it myself.
Yeah. Oh, do you? Yeah. And so making your own yogurts, fermenting your own foods, that's just it's on my bucket list. But it's so important. But I do love to go to the farmer's market and pick up some somebody else makes. But yeah, so those sort of things are great. L. reuteri is a very important bacteria. It does.
Because the no food is not found in any food. When you buy it, it's actually made food.
Put phosphorus in it, yeah, maybe.
So it's not something we have a certain vegetable or a certain meat.
Right. Yeah, we purposely get it.
Purposely get it. When you buy it, it's usually what they eat that with, so it's so small that we use this one to take pressure off the increases the amount of bacteria.
That's awesome. Yeah, people who eat fermented foods, and if you're making your own yogurts like that, you will have a very healthy microbiome. And that helps a lot. Now, I do find, again, sometimes even, it depends on your genetics, it depends on how you handle histamine. I find that some people have trouble with fermented foods sometimes. If you find you're getting a rash from it, or you find you're bloating, or you're getting flushed from it, you could have a problem just breaking down some of the histamines that are a little bit more higher in histamine. So again, if you do have problems with specific things, there could be something else going on that you might need to address. You might need a little support if you're going to have those. And that goes along with the fibers. Again, if people cannot tolerate fiber, I have to think about SIBO, and we test for it and we treat it. So, exercising regularly, yes. I mean, exercise is not just, we don't just say it to say it. You gotta get out and do something, and more movement that you can do every day. Even if you sit at a desk all day long, then in that 8-hour period of time you're at work at your desk, get up 3 times and do 10 squats. They have found that doing that is about as good as a 30-minute walk when you get home after a meal. It's engaging, anything that engages the muscles. Think about it, it's pulling the glucose from your bloodstream. So even like heel lifts, like doing something while if you have to sit for long periods of time, you can still get up and do at least some squats or something like that, get moving a little bit more, try to walk after meals. even more important, especially for our metabolic health. They've shown that a 20-minute walk after a meal is about as good as some of the, glucose lowering medications for patients who have diabetes. Sleep, very important. This cannot be ignored either. So just because you're like, that I'm good on 5 hours of sleep, I can get it all done, and I got to stay up late because I got to do my work, and then I got to get up early because I got to get everybody ready for their work for school. It's going to get everything. Sleep is for restoration. It's for repair. It's for repairing our hormones. It's for controlling our cortisol. It's all of that. Like if you're not sleeping well, you're probably gaining weight. You're not feeling good. It's just a matter of time. And your joints may be aching. Again, it's a problem. Like we are a sleep deprived community, world. So, but try to prioritize it as much as you can and getting off of devices. I know I can be bad about it too, but I know if I'm on my computer too late, if I'm on it till 10 o'clock, it'll be 11:30 before I fall asleep. Shuts down your melatonin. Does it every time. Even if you wear blue blockers. I can't do blue blockers because I'm supposed to have them in my classes. I don't think they work at all, but maybe it's because that's one of the best ones. But the bottom line is try to get off your devices. Try to have some sort of sleep hygiene practice that you do every day. Have the wind down, have the slow down. You want to sleep, you got to sleep. Because if you don't have good sleep, you're not going to be good at everything else you do the next day. So we can't ignore that. Obviously, managing chronic stress, there are techniques. There's breath work, there's meditation. There's lots of different things. You just have to lean into it, and you got to be consistent. So it's those two things. And I always say, pair it with something you're doing every single day, like brushing your teeth. So, if you're going to brush your teeth, that means you go sit down and you do 2 minutes of breath work before you start your day, or you do a meditation, or you do a gratitude journaling, or something like that. And that will set you up for success for the rest of the day. And avoiding unnecessary antibiotics, again, just don't go to the urgent care when you have the sniffles and that sort of throat, and you're going to get something. You usually don't need it. Now, if you've got pus on your tonsils and your kid has strep and that sort of thing, that's a little bit different. But just judicious use of antibiotics is the most important thing that I can emphasize here. And then really minimize ultra-processed foods and alcohol. So alcohol is a big driver of gut disruption. And actually, I'm sad that I wasn't here for the Curious Elixir party because I still want to try those because mocktails are the new thing. And really, the less alcohol we can drink now, the better so much of our health is going to be because they're really talking about it probably breast cancer because it's got so many problems associated with it. Save it for a special occasion. Save it for the engagement party or the birthday party or whatever. And people feel like, oh, I only drink like 2 or 3 glasses a day. Okay, 7 times 3, that's 21, that's a lot. That's more than what was recommended, and I really, there's no healthy amount of alcohol to be drinking. So those are kind of the things that really can start your future gut back into balance. Now, what I like to do with my patients, and actually what I do a lot of times in a client membership too, is I do recommend certain vitamin supplements at the same time that we do a 21-day reset diet, which is a low inflammatory diet. So your gut supplements can start working on healing your gut lining, and then you're going to be more resilient on the other side. And then you can also, being a clean slate, your body can now, the noise is clear, because we have a noisy body, and you can't tell what's causing what symptoms. But when you clean the slate, and then you start reintroducing some of these inflammatory foods, you're going to know, like, oh gosh, that causes my joint pain for 5 days after I eat that. Or that's the rash that keeps showing up. Like you're going to, it's the gold standard really for learning about food sensitivities. So that's why I love doing really heavy like an elimination diet at the same time. And so if, this just brings me to if that seems overwhelming like I would say I'm going to do that. I just can't do it, or I can't figure out how to do that. I don't know what I'm supposed to eat. We do have a coaching membership, and I have partnered with Numa to be able to run our coaching membership at a special price, and you get an extra call when you are a Numa member. And so what it is walking you through my new process, and of course it starts with the gut healing. I find that the first 2 months are pretty pivotal for a lot of people. When you do the gut healing work, you get all the supplements, you clear the noise, you start coming back. Like, it's not what I tell you what to eat, like, you can't eat that. You're going to come back and say, this is why I can't eat this. and this is what it's doing to me. I tried it one more time to make sure it was it, and it was. And so again, like it's that body awareness that people start to develop that just makes it a no-brainer. And it's very powerful to feel it, and then we will choose maybe to do differently later. And so that's what the Renew Elevated Foundation's coaching membership is. It's actually a 6-month membership. It's a monthly membership, and you get calls with me, you get calls with my health coach, and we walk you through this process. You get a course that goes along with it, and there's other mini courses that will be coming out that go along with each of the letters too, that are deeper dives, and we will plan on adding a little bit of, I want you all to be able to understand how you interpret your lab work when you get things done too, so that will be part of it as well. So all of these things is why we want to run it as a membership. If people aren't ready for one-on-one, if you don't need meds, if you don't need like hormone replacement medications, you just want to get healthy and create your own health, it's a guidance. It's just an expert. You get guided by us along the way. And so if you are ready to feel like your best, because there's a lot of noise out there on Instagram, and everybody's going to tell this is the best supplement ever, this is the best diet ever, this is the best whatever. There is never a magic bullet, so don't believe it. Like it sounds too good to be true. It is. You usually have to do multiple things, but there is a stepwise approach you can take in order to do it. And again, this is kind of a building the foundation. Like what you learn now is going to help you 20 years from now. What you learn now is going to change the way your kids are going to start recognizing it, like how you're cooking, what you're eating. And then, it took my kid 6 years, like she was having so many gut issues and acne and like PMS and all the things. Finally, she came back, she's like, well, I can't have gluten. Dairy makes me have acne. And so I meal prep all the time, and I feel my best, and I know if I get gluten, I know exactly why, and she gets belly symptoms, but it's not always belly stuff. It can be a rash, it can be something else. So it may take them a while to come around, but sometimes just when they watch you and they see you do stuff, it's going to rub off on them later, and when they're in college, making their own food, they'll be able to figure it out. And so again, if you want to stay consistent with some guidance and accountability, we give you menus, we give you recipes, we give you substitutes for things, and you're like, but wait, I eat this every day, but you can't have it on the 21-day reset. We give you the ideas of what to plug in instead. So again, it's just a guidance along the way, and it helps you create your own health, because we want to give you the tools so you can do it yourself, and you're going to go equipped to the doctor with a lot of information, and you can help guide your treatment plan. So that's what we really want people to do, is to be able to be participants in their healthcare and not just be given a prescription. So that is all I have today. So I am happy to take any questions. This QR code tells you more about the membership if you're interested, but I love answering questions as well. So yes.
I haven't already done a lot of what you're saying, but I didn't really about 130 pounds.
130?
I was losing 3 pounds.
Oh my
I was
goodness.
on all kinds of medicines. I was definitely on the I was trying to do my best. I was going to the gym, I was going to eat healthier. I was eating very keto and stuff, and stuff, and this kind of stuff, all that stuff. And all that healthy foods now, the wheat fasting and regular fasting.
Good.
All kinds of food foods. I've gotten most of my health problems resolved in my own medicines.
Yeah.
Probably that. So no more medicines for the probably the most stable. To be fair, I do also have to do this kind of out the process of doing that. That's going to provide information all my life. I've had issues with sunlight, and stuff my life, and all the things that all were explained from my weeks.
Right.
But there's always secrets.
Okay.
Some out there that can't sleep consistently for the night. So, I tried several supplements and others for the work. So they're not doing very obvious.
Yeah.
Try my best to stay off electronics and try to get my head under there. Try to get tired. I'm tired now. So I'm going to sleep okay. So now I get the pain. So every hour, only an hour, I'm going to sleep. Roll to this side, roll to that side, roll that, goes this first.
Yeah. So there are. So really for sleep and for inflammation. So number one, cumin is a great supplement. It's an anti-inflammatory natural supplement. I do like curcumin. There's lots of different combinations of natural anti-inflammatory you can do, and a lot of herbs and spices have some anti-inflammatory components in it, so just make sure to spice things up with area.
I make a variable with the honey or delicious spices.
Okay. Good. Yeah. And so what curcumin is turmeric, but it's kind of hard for us to get that turmeric just from the spices. So anyway, it comes in a supplement. So I find that a lot of times that can help with discomfort, but also for sleep, magnesium. Magnesium, we are all addicted to magnesium. Okay, so and there's multiple different types of magnesium. Glycinate, and then malate helps if you have muscle spasms or anything like that. I find that the malate helps that you get active brain at night. Mag-threonate is the one that causes the area. Yeah, so magnesium threonate, sometimes they call it neuromag. So that's a good one. And then there's some combinations that have like L-theanine, it's a calming, like GABA is calming, 5-HTP is something that is in a lot of them. One of my favorites that Designs for Health has is called Insomnitol, and it's a combination. It does have a little melatonin in it too, so I don't know how you do with melatonin.
I have one sleep called that has some medicine.
Yeah. And then there's a new, there are some peptides out there. So, and actually, you guys have it here. I mean, I didn't see if it was on the shelf, but it's called Restored. And it is PeptiSleep is the name of the peptide in it, and it's an all-natural peptide. I find with that peptide, I get more deep sleep. Now, see, I haven't ordered it, so I'm tracking. Yeah.
It's a deep sleep. It's not going to make you, I did it too, it doesn't make you feel like, man, I'm just totally knocked out. But you look at your artery and you're like, whoa, I got so much more deep sleep.
Yeah, I've consistently gotten 20 to 30 minutes more deep sleep, and I was like really bad. I was usually less than an hour.
I get a lot of REM sleep.
Yeah.
Because I'm on that. Like usually, I get so exhausted by I'll get good REM sleep, like weird dreams and stuff. For a bit, and then I'll wake up and
yeah, so that's why it's called Restored, and I think you guys have it here.
Yeah, you can sell off the shelf, right? And you can also, you can get like a discount when you order it online, you know, a QR code that you can scan if you get like $10 off. And
yeah, so I do like that too. And sometimes you have to see what's going to be best for you. Like there's, I have gone through different supplements to see which ones serve me best. But yeah, I do like the combination, and I like the sleep peptide as well. It's great.
Thank you. So if we do the member show, you take the labs, and then would you recommend certain supplements?
Well,
because I just kind of like throw a dart and go, I'm doing research, and right now I'm on, just an amino acid powder and water, and just try to get the trace minerals in, and I'll try this.
Which is good.
I'll try
Yeah.
this.
So I'm all about targeted supplementation.
Right, and so that would be part of it.
That would be part of it. So at the beginning, everybody gets the gut healing at the beginning because again, we don't want to be chasing things down. But what I do is like when I have called the Clinical Insights call, I will walk through my labs. I want everybody, I'll tell everybody to bring their labs, to the call. Y'all be looking at your labs while I walk through what everything means and what the optimal numbers are, because the reference ranges on those labs are not the ones, right? They're not optimal. So
I'm right now seeing my parents who are in their 70s, who were always healthy, having the normal aging issues, and they've never been on medication, and now it's like, I take metformin, the toilet issue, doing joint pain, we have that, now I'm gonna take this. So I've never talked to so many people that go to the doctor so often, but doctors are healthy.
yeah, and the sad thing is that insurance, and again, maybe this has got to change soon, because we know insulin goes up level 4, hemoglobin A1C, and glucose does, and it is not part of standard medical advice.
It's like they're almost giving up and going, this is what I'm supposed to be doing now at this age.
I'm just going to take my medicine.
Yeah. And if I would get my dad to do this as well.
Yes.
And you would look at the labs, but then if you have a primary care physician.
Well, yeah, so the primary care obviously is going to be running the show, but what we do is I'll be educating you about what those labs mean.
Right.
And how can you impact your hemoglobin A1C and your insulin? So it's really the way we eat. Nobody thinks about this way. We've got to pair our carbs with a healthy fat and protein. Don't eat a naked carb. I tell my patients that all the time. Forget the naked carb. So a naked carb is eating a handful of grapes walking out the door. It's eating an apple. It's eating a banana with nothing else with it. So it can be that assumingly healthy thing that spikes your blood sugar. So wearing a continuous glucose monitor. Dress up your carbs.
Eat the meat first, and then
Yes. Yes. And break your fast. So how you break your fast in the morning will set the stage for the rest of the day with your blood sugar. So you can either be on a roller coaster ride, if you want to eat some pancakes or some rich toast, or you can eat a healthy fat and a protein and have this and eat a little bit of carb. Like if you want, you still want the pancake or whatever, just eat a healthy fat, have some egg with it, or some chia seed pudding, something with some protein and a little healthy fat, maybe have avocado. That's going to modulate your blood sugar spike. This is about controlling our blood sugar regulation, and we can do it with how we eat. We also can do it with how we move. And so movement, ideally, if people could actually move after each meal, even a 10-minute walk. Like if you could do something, or 10 squats, 10-minute walk, 10 squats, something like that, then it's a game changer for your blood sugar. And the way we know that is because now you can get a continuous glucose monitor for pretty cheap. Stello.com. I want to say you can get 2 for like $100. Oh, is it? Yeah. And so it is. You do not get a prescription when you go for therapy. Well, we have to. So the sad thing is, not even a doctor can write the prescription that's going to be covered by insurance. If you just have pre-diabetes. It's only when you become a diabetic can you have ones like this. Exactly. And so we know insulin rises first before the blood sugar rises. So I like to check a fasting insulin level on everyone because we're going to know that well in advance of that hemoglobin A1C going up. And really, even if you're healthy, you don't have an insulin regulation problem, I'm still talking to people about not eating anything carb and really just making sure you are pairing things. Like pay attention to it. You really want that muffin, but you're like, no, let me eat the egg before I eat the muffin. Huge difference in your blood sugar rise. And I mean, I wear a continuous glucose monitor periodically all the time, and I even wear it over the holidays. And I have fun. I love pumpkin stuff, and I wear it at Thanksgiving. But I know I can modulate my blood sugar spike when I make my gluten-free pumpkin muffins. If I have an egg before I eat a muffin, it goes up 10 points instead of 50 or 60 points. Yeah, and you're going to learn what are the things that really raise your blood sugar that are seemingly healthy, like oatmeal, like grapes, like things like that. They'll really be blood sugar spikers. Juices, like I love, yeah.
Maybe cherry juice.
Yeah. And if you have the juices, just have something with it. Have a little healthy fat and protein. And again, have
straight up organic, delicious food.
Straight up organic, delicious food is great, but it will spike your blood sugar.
Okay.
Yeah.
I just want to be sure.
Yeah, but it will spike your blood sugar. So I still like, even if you're going to have a peach or whatever, an orange, in a handful of almonds before you do it. It still can be a blood sugar spiker. Now we know with the fruit, you're getting some of the fiber, like it depends on what fruit you're eating. So if you eat the whole fruit and not just like juice, it's going to be a bigger spiker than the whole fruit itself. But still, again, we become more sensitive to these blood sugar rises that we get. And so really, if you can start just paying attention to that and making these little pivots and changes, and having a couple almonds, and you're going to have your bowl of fruit that you want, it just modulates the blood sugar spike. We want to just stay a little bit more even keel. We don't necessarily want to do this. Now, it's normal for your blood sugar to go up as long as it comes down in a timely fashion, like when you're wearing a continuous glucose monitor. But you're going to know when something is problematic and you know what to try.
When you talk about adequate protein, is it one, how much is adequate protein? It probably depends on body weight.
1.6 grams per kilogram of body weight is what you're supposed to have. So on average for a female, I say for 30 to 40 grams per meal, eating 3 meals a day.
Right, it's hard to do. Meal, so you can't just say like I'm just gonna have a lot of protein at lunch and dinner because I have a hard time getting the protein in at breakfast.
So, you know what I do is I save whatever meat I've had for dinner, whatever protein I had for dinner, and I am eating it when I'm walking the gym from the gym. That is like, it's going to be protein forward, even when and I used to fast, so I was into the intermittent fasting. It's not that intermittent fasting is bad, it's great for some people. But for women, sometimes if you're not sleeping well, you're in a perimenopausal transition, you're stressed out, like, it's just another stressor for your body, so sometimes it's not good for everybody. It does, and I used to love the intermittent fasting, just not eat until 11, but now I'm really focused on my protein because, you know, I'm 56, we are losing it significantly if we don't do something about it. So it's resistance training, it's moving, it's adding protein as much as you can, and we're talking about, so I would say a chicken breast that's about the size of my palm is probably 25 or 30 grams-ish, something like that. So you have to get a little creative with what you're eating. Yeah.
I'm in her elevated foundations. Yeah, and it's been really, it does feel like you're drinking from a fire hydrant. And you realize you jump the calls with her, and you're like, oh, this is the slow. I get it. I was like, yeah, I get it. And so I haven't been good about showing up for calls. And I did this past week, and I was like, this is fine. Calls.
Right.
So it really is important that you're doing calls. And I think what you were saying one of the times is that you're going to go over your blood work.
Yeah, I'm going to bring my blood work, and I'll tell everybody, if anybody has labs, they have questions on, bring your labs to the call. We're going to talk through what everything means, what the normal reference range is, what you do if it's abnormal or suboptimal. You know, vitamin D is one of those that doesn't get looked at all the time, and many of us are suboptimal vitamin D, and vitamin D has to do with immune health and like, you know, processes in the body, so we kind of need it. And we find that we're just not absorbing it as well. We have gut health issues. You're not absorbing a lot of nutrients when you have gut health issues. So even people who have had, say, suboptimal thyroid numbers and if they be on low dose thyroid, I find that people can start weaning off of thyroid medications when we heal their gut lining because they're absorbing the nutrients better that actually make your thyroid work up. So it kind of all goes hand in hand. Which is why the gut healing is so very important for everything, whether we're talking about hormones or any other symptom we have. Yeah. Yes. That's really good.
You were saying about getting your gut right can help with cardiovascular issues. What about blood pressure?
And blood pressure, yes. So blood pressure, you know, a lot of it has to do with our nitric oxide production in our body, which nitric oxide is probably going to be like the molecule of the decade or something. But nitric oxide, and there's even supplements now that have nitric oxide, and I have a list of nitric oxide producing foods. So things that you can focus on to help with blood pressure. And I find that a lot of times when we heal the gut lining, we lower the body's level of inflammation, and a lot of times we can start weaning people off blood pressure
That's
medicine.
one of the ones that got
Yeah. So,
There's also breath work.
and there's breath work. Breath work increases nitric oxide, exactly. So again, it's a combination of things that you could be doing that we know just our nitric oxide production goes down as we age too, but it's that inflammatory risk and that inflammatory level that keeps going up, called inflammaging sometimes, but we've got to do something to address that. And again, it has to do with what we're doing every day and your gut lining. Yeah.
Hopefully not that.
And yeah, all of that, you know. Yes, ma'am.
Is cortisol and then inflammatory factors, like are those measurable in the bloodstream?
So I like to do a 5-point cortisol. So it's a little different test. It's a salivary cortisol test. You can measure cortisol in the blood, do a first morning day of cortisol, but I find that it's not the most accurate way to do it. I want to know where you are when you wake up in the morning, where you are 30 minutes after you wake up, so you can get up and go. Like, are you going up like you're supposed to? And does your curve come down like it's supposed to, or are you climbing at night, in the middle of the night? That's the other thing, the adrenal dysfunction thing that keeps you up in the middle of the night. But it's a 5-point cortisol, it's a saliva test. You do it 5 different times a day, it tells you when to do it, and then you can kind of see which curve is. Yeah. And so for adrenal dysfunction, I've always have healed with that already. We're improving the nutrient status already. And then when we go to nourishing the adrenal adrenals, there are adrenal adaptogens out there that help your body to adapt to stress. Now, we're doing that in addition to having a stress management practice of some sort at home. So you're always doing that plus an adrenal adaptogen and something that nourishes your adrenals. There's adrenal nutrients that it can be sometimes your DHEA is low, your DHEAS is low, that's in lab value as well. So all of those things we usually support for a while, and a lot of times your body takes over and then you don't need the supplements anymore, the adaptogens anymore. So, yeah.
What's the correlation between HRV and cortisol testing?
Yeah, and that's,
Place that, the cortisol testing, if you're monitoring HRV.
you know, again, I think there's, and I don't know which is the best HRV, you know, tracking device. I don't know how good, you know, an Aura really is for it. I know Whoop can be a little bit better for it. So I still like to see the numbers and know the numbers. Plus, an HRV is great, and yes, you can tell when your stress level is better, when things are getting better, your HRV is getting better. Yeah. So, but that's, yeah, but I wouldn't exchange one for the other. I still like to, especially if somebody's having fatigue or if somebody's really having like so groggy when they wake up in the morning, like I get 10 hours of sleep and I still can't get up. Like, you know, there's probably something going on with the adrenals too. So we look at that as well. Yes, ma'am.
We were talking before, I was talking about I had rice gastritis.
Mm-hmm.
Could I do this while I'm still trying to heal my stomach?
Yes, yes, and actually, probably a lot of the supplements we use for gut healing, it helps like heal stomach lining as well as the lining of the intestines. So, and you may have heard of, we talked about colostrum just a little bit earlier, but either colostrum or immunoglobulin is a good gut healer. It's one of the things that I like to use to heal the gut lining. So, you know, there are other things that you can be doing, and there's different things that contribute to your risk of gastritis. So a lot of times, yeah,
Prescription and stuff.
okay, is that where it's from? This is from. Yeah, and a lot of times you can feel it. So you may not, you know, again, I would wait until you go do another scope to see if it's fully healed before, I don't know if you're on, how many PIs you're on.
I'm not taking that.
Okay,
I am taking Pepsi.
okay,
At 9.
okay. Just Pepsi at night is not bad, but sometimes if you're on coffee doses, it's a little bit.
I actually found a support group on Facebook that was started by a doctor that wrote gastritis healing book. Actually,
I've heard that name.
Yes, your house.
Okay.
So I'm following that.
Oh, good.
Yeah.
Yeah, because there's a lot of gut healing foods, right? There's gut healing foods that you can do, but really the supplements I find, again, a lot of times we can heal it, symptoms get better, we can let them go, and your body takes over. And it used to be that, you know, I feel like acid has gotten, hydrochloric acid in our stomach has gotten kind of a bad rap. We need that stuff as well. Right. So, and it's unfortunate sometimes that, you know, the knee jerk is to put somebody on PPI or Pepsi right away before actually knowing what's going on, because sometimes we just don't have enough acid that can be lost. And a lot of times it's a food related. It's that we can figure out what's causing the problem. So you may not need medicine after all. But you can always use it as a way right now because we like that. I would say you probably need it. To make sure that you're getting good. Nicely, but there's other ways to get it too with it's more you know, minerals and herbs that kind of help soothe the lining of the stomach and kind of